Hi, my name's Grace. I'm going to be a PA student that's working with you today.
Nice to meet you.
Nice to meet you. Before we get started, can I just confirm your name and date of birth, please?
Yeah, Paul Bartlett, 7/22/1953.
Okay. And what brings you in today?
I've just had really bad chest pain and shortness of breath.
Okay, can you tell me a little bit more about that?
Yeah, so I have a history of heart disease and hypertension, and it was just so bad my wife made me come into the ED. It's been going on since the last doctor appointment, but it just got really, really bad today. So.
Okay, and so you said it's been going on since your last doctor's appointment, but when approximately was that doctor's appointment?
It was a few weeks ago.
Okay.
Yeah.
And has it been going on consistently since that happened?
Yeah.
It has? Okay, can you point to where the pain is?
Just right here all over my chest.
So it's kind of spread all over, it's not localized just to your chest?
Well, it's kind of everywhere, but it's sharper right where my heart is a little bit.
Okay,
So
has that,
makes me worried.
yeah, has that pain spread to any other areas?
Not that I've noticed.
No, okay, not to your arms or anywhere else?
No.
Okay. Have you tried anything that's made these symptoms better?
So I have been taking my albuterol inhaler every day,
Okay.
but I don't think it's making it too much better.
Okay. And over the course of the last couple of weeks, during the day, has anything made it worse?
No, I don't think so.
No, it's been a pretty consistent pain.
Yeah.
How exactly would you describe the pain?
Sharp, painful,
Okay.
a lot of pressure.
Could you rate it on a scale of 1 to 10?
Probably an 8 or 9, but today it got up to a 10.
Okay, and that's when you decided it was time to come into the hospital? Yeah. If it wasn't for your wife, would you have come in?
I think so.
Yeah.
Eventually.
Okay, well, have you had any other symptoms other than the shortness of breath and the heart pain?
I don't think so.
No,
That's about
that's
it.
pretty much it.
Yeah.
What's your biggest concern regarding this?
I'm worried about it being my COPD,
Okay.
but I don't know.
How long have you had COPD for?
For a while now. I
Okay.
would say like 15, 20 years.
Do you have any other current medical conditions?
So I also have heart disease and hypertension, and then the COPD.
Okay, and so the COPD has been going on for 15 to 20 years. How long have you had hypertension? and heart disease?
About the same length of time as well.
Okay. Do you have any other past medical history as a child? Any surgeries, hospitalizations?
Nope.
No?
I didn't have any surgeries or anything as a child that I can remember.
You were never sick with the chicken pox or anything like that?
I did have the chicken pox.
You did?
Yeah.
Okay. Well, are you currently taking any medications?
Yeah, I'm on amlodipine, I'm on atorvastatin, and then I have my albuterol inhaler.
Okay, and approximately how many times a day and what dosage of those meds do you take?
Amlodipine, 10 milligrams, I think, once a day, and then atorvastatin is 40 milligrams, and I take that once a day as well.
Okay. Are you allergic to any medication?
Yes. So I'm allergic to penicillin, lorazepam, aspirin, and benzotropine.
Okay.
Yeah.
It's a lot of drugs
Yeah.
to be allergic to. Well, so now I'm just going to ask you some questions I ask all my patients about your past medical screenings. And at your age, you should have had a prostate exam as well as a colonoscopy. Have you had those in the recent years?
Yep, those were clear.
You both came back clear?
Mhm.
Okay, that's good to hear.
Yep.
And are you up to date on your vaccinations, such as your measles, mumps, rubella?
I believe so, yeah.
Have you had your flu shot for this upcoming season?
Yes.
You have? Okay, that's important
Yes.
to make sure that you don't get sick. Have you had your herpes zoster
I think
vaccination?
so. Yeah.
Okay, so you're pretty sure you're up to date on all of that.
Yeah, I think
Okay.
a few weeks ago they made sure that I was up to date.
Okay, well that's good to hear. Now I'm just going to ask you some questions about your background, about you and your family. I ask all my patients these.
Yeah.
So you mentioned your wife brought you in. Do you live with anyone else?
Nope, just the two of us.
Just the two of you? Do you guys have any children?
Yeah, but they have moved out. They have their own children now.
Oh, that's awesome that you're a grandparent.
Yes.
How is that?
It's good.
What do you do for a living?
So I'm retired now,
Okay.
but I used to be a football coach.
Oh wow, for how many years?
I think 50.
Oh my gosh.
That doesn't make sense.
That's a
but-
long time.
Yeah, that's when I
Wow.
started dreaming about it, and I started early.
Did you go to school?
Yeah, I went to high school, and I tried college, but I just decided to stop doing that.
Didn't like it, yeah. Are you enjoying the retired life?
Yeah.
So now I'm going to ask about substance use. Do you consume alcohol?
Occasionally.
Occasionally, about how many drinks a week?
Probably a few beers, mostly on the weekends.
Okay.
Yeah.
Do you consume any drugs?
Nope.
No recreational drug use such as marijuana?
No.
No. Do you smoke tobacco?
Nope. I used to, but I quit 5 years ago.
Oh, that's awesome. That's good to hear.
Yes.
When you used to, how long did you smoke for?
Since I was probably 16.
Oh, wow. Okay. Well, that's awesome that you were able to
Yeah.
quit. Have you had any travel outside of the United States recently?
No.
No? Just been staying here at home?
Yeah.
Okay, now I'm going to ask you about some family history about your mom, your dad, and your siblings. Do you guys have any family history of heart disease? Or
Yeah. So my dad died when he was 45 from a heart attack. And then my mom, she died when she was 80, but she didn't have any heart disease.
Okay.
And then I also have my brother, he's 60, and he also survived a heart attack. So
Okay.
a
And
lot
now
of heart disease.
it sounds like heart disease kind of runs in your dad's side of the family. Did his parents have any heart problems?
I think they did, but I don't remember.
Okay. Do you have any other siblings?
No, just my brother.
No, and he also had the heart problems?
Yeah.
Okay. Does your family have any other history of like blood clotting disorders or respiratory diseases?
Not that I'm aware of.
No cancer?
Right.
No? Okay. Now I'm just going to ask you some other questions about your associated symptoms. And you mentioned shortness of breath.
Mm-hmm.
Have you had any other respiratory problems? Such as like difficulty breathing, pain on breathing?
No, not that I've noticed.
No?
Yeah.
Okay. And when you do have that shortness of breath, is that when the chest pain comes and goes, are they associated together or they come separately?
Sometimes they're together, but I don't know. So I have the chest pain and I have the shortness of breath, and sometimes they do happen together,
Okay.
but sometimes they happen separately too. So.
Okay. Have you had any problems with digesting your food, such as constipation or diarrhea?
No.
No GI problems. How about have you had any like heartburn, such as
Yeah. Sometimes
Yeah.
I get heartburn.
after meals?
Yeah.
Okay. Have you noticed any swelling in your arms or legs?
No, not more than normal.
No, not when you sit down, or
I don't think so.
no problems with blood flow? Okay. How's your mental health and your support system at home?
Pretty good.
It's
My
good.
wife is all over my health, so
Well,
trying
that's
to
good
keep
to
me
hear.
healthier.
How's your diet and exercise routine?
I probably could be better.
Mhm.
But my wife cooks, so that's good. We eat at home.
That's good. Does she cook healthy meals for you?
Yeah, pretty
Okay.
healthy.
That's
She
pretty
makes
important.
sure I eat my veggies.
Yeah,
Yeah.
that's important for your heart, to keep your heart healthy. Do you have a good exercise routine in place to go on walks, or?
I walk around the neighborhood sometimes, but I
Okay.
probably need to do better.
Yeah, even just a couple, like 10 minutes a day, 15 can be helpful. So if you and your wife just want to go on a walk after dinner,
Yeah.
that could be really helpful for your heart.
Yeah.
Okay, well, I'm going to go talk to my supervising doctor, and we're going to get back and get a good plan for you to get you out of here as healthy as possible.
Okay.
All right,
Thank you.